Good morning, everyone. I want to thank you for joining me today for this presentation. Just to give you a little bit of background about Zeldis in case you're not familiar with us. We are a boutique full-service market research company. One of the industries that we focus on is healthcare, and a lot of what we've been doing recently in this space has been around healthcare reform. So we compiled some findings that we've seen kind of consistently. We do custom research, so the data that we collect is proprietary. So I'm unable to share details, but I can at a very high level talk about some of the themes that we've seen kind of consistently across projects, across clients, and across audiences. So what we're going to be talking about today is based on over a dozen studies that we've conducted in the past few years. They cover, represent all different audiences, employers, brokers, consumers. On the employer side, a lot of what we've done recently just so happens to have been with small and mid-sized companies, so 50 to 1,500 employees, but we have also some national companies represented as well. As you can see, it comes from a lot of different interviews, over 500 qualitative discussions and even more quantitative interviews. And in terms of methodologies, we've done everything from quantitative online surveys to all sorts of qualitative methodologies, in-person focus groups, in-depth interviews, bulletin boards, and some webcam interviews. And actually for this presentation, because the information that we used to compile this was from proprietary research, we aren't able to share quotes from those studies. So we actually went out and did some sponsored our own interviews so that we'd be able to give you some kind of color and flavor add to the presentation. So we've done that using Focus Vision's interview technology, so you'll see some video clips throughout the presentation from respondents. So first, to introduce you to some of the people that we spoke with on the benefit manager and broker side.
All right, so my name is Laura, and I have about 650 employees. I'm in the quick service restaurant business. Position in my company is I'm the franchisee and owner with my father.
My name is Rod. I'm the Managing Director of Health Strategies Group. We are a pharmaceutical and medical device insight, market research, and consulting firm based in New Jersey. We currently have about 87 employees in New Jersey, California, and 5 or 6 other states. Sure. Yeah, so my name is Chris. I work for a large national consulting firm based in New York City. I've been on the brokerage side, started on the carrier side, been on the brokerage side for about 10 years.
And we also spoke to several consumers. When we were recruiting for this, we wanted to make sure that we were picking individuals that represented a variety of different demographic backgrounds and healthcare needs. So we spoke to one single male, no children, 30 years old, who actually bought health insurance on his own through the exchange. Another single male with no children, also in his 30s, covered through his employer and had some changes to his benefits in the past year. And then a married male with one child in his 50s has health insurance through his employer and hasn't experienced any changes in the past year to the benefits. So now that you have all the background, what are we going to be talking about today? So the 5 trends that we've seen consistently across all of the research we've been doing in the last few years. First, there's a lack of knowledge and understanding about healthcare reform in general. That most people are waiting and seeing before they make any changes. There's confusion about the exchange. Managing costs is another theme. And any alternative approaches or alternative ideas of how to change benefits in terms of in response to healthcare reform. So when it comes to the employers, healthcare is only one of many job functions that they provide. Many of them are spread very thin. Companies are understaffed, and they just don't have the time that it would require to really be up to date on all of the legislation and all the changes that are going on. So they rely very heavily on their broker for knowledge and information about healthcare reform.
We just got a 39-page document for compliance in 2015 and 2016 with ACA taxes and fees. That's like, oh no, now I've got to deal with business and run my business too. So you really need some smart people to help you negotiate it because we're not educated. We have to educate ourselves.
Yeah.
Yes, absolutely, and it seems to be changing all the time. So, you think one thing's happening, and it's happening definitely in 2013. They extended to 2014. We hear that 30 hours is the number, and then we hear that they're going to raise that number, to the higher one so that you have to offer those employees more. But what it does is it affects our ability to hire good quality employees because they want to work, as many hours as they can.
Brokers are actually knowledgeable, and it's really through all the efforts. They work very hard to do research and to make sure they know what's going on and to stay up to date with all the latest changes. They realize that their clients rely on them for that information, so they know it's an important thing for them to do. And although they understand healthcare reform well, they are frustrated with how complicated everything is and all the changes. One of the people we spoke to mentioned that 2 years ago they had 2 lawyers in their firm, and now they have 20.
I think the overall lack of knowledge on healthcare, on how plans work, on how networks work, on how doctors bill, on how doctors are paid is a mystery to people in the field, and is certainly a bigger mystery to those that are ultimately the end user. Yeah. And I think it makes it harder to navigate the system, and is certainly frustrating for those that ultimately rely on this coverage to prevent financial hardship, but really don't know where to turn to get the right answers. Yeah. And I will say healthcare reform, I think, is trying to make some of that information public knowledge and more readily available. But certainly that's a big task.
And consumers have very limited knowledge. Many of them know it by name only, and they can't give you details. They can't tell you specifics about the why, but many of them believe that healthcare reform is going to have a negative impact on them. A lot of them, what they know about healthcare reform, as little as it is, comes primarily from media or word of mouth. So this emphasizes the importance of keeping brokers in the loop because they're a big resource for employers, and also educating and providing resources for employers and consumers wherever possible, even though health insurers is not the first place that they would turn for this information. Given the general lack of knowledge out there, any education and information for these populations would be beneficial. So another topic that we talk a lot about is what are you doing? So what are you changing? What are you going to be doing to benefits or in choosing benefits in response to all the changes that are going on? And what we found out is that not a whole lot. Very few employers have made any changes other than what they've needed to for compliance, and they plan to wait and see. A lot of them really don't want to make changes. Benefits they believe are a key part of what they can offer to their employees, and they really are reluctant to make any changes to that. They rely on their brokers to tell them, what they need to do next according to the legislation.
Well, I mean, I'm hoping that we'll be able to insure them the way that we are and absorb the cost, so it's no more expensive for them to participate in our health plan. I'm hoping that we can educate them and let them know that this is a very fair plan and a good one out there. That's what we try to provide for them. But I don't really know what the future is going to bring, if they keep dropping or if the exchange will become a viable option for us, or even, us giving them money so they can go find their own. I mean, maybe that'll be less of an administration nightmare. I don't know. I hope that it all settles down so that we can figure it out because, It's an expensive part of doing business.
De minimis, it means that we're going to have no choice but to move away from paying 100% of associate premiums just from a pure cost measurement. That's the first step we're going to take next year, and then wait until the end of next year to decide what we're doing in 2016 relative. Do we step away from our current PPO plan and into one of the ACA compliant models, or do we even go further and contemplate moving into some kind of a defined benefit plan or some kind of benefit plan which puts associates into the exchanges, which for us, because of our multi-state locations, is a real challenge for us.
Brokers keep their clients informed so they can remain compliant. They let them know, exactly what they need to do and when they need to do it by. They do bring changes to their clients and suggest alternatives. They're not really the ones that are waiting and seeing. They actually are kind of encouraging their clients to get ahead of things and make the changes now. But when they do, they're often met with reluctance, confusion, and basically just a general lack of understanding of the alternatives from the employers. And here we have a quote from a broker. Exchange has been a pretty common word, a pretty popular word. I think everybody talks about it, but very few are ready to jump right into it. And consumers have really not given much thought at all to how healthcare reform affects them. Basically, they really want to maintain what they have. They want the same plan with the same coverage and the same doctors for the same amount of money that they've been paying in the past. So the idea of change is really very scary to them. And here we have a quote. I haven't developed much of a relationship with my health insurance company. If I could find a cheaper rate and the exact coverage, I wouldn't feel too much loyalty. I want it to be a popular name. If I could change for the better of my wallet, I would. So when it comes to change, the only thing that would motivate consumers is saving money. So this underscores, again, the importance of maintaining strong broker relationships, since they are really going to be the ones kind of leading the change with their clients, and then also offering a variety of plan alternatives so that consumers and employees can most closely match the plan options that they've had in the past. In terms of managing costs, as I mentioned, employers really want to continue offering the same benefits, but they acknowledge that rising costs have really put pressure on them. So some have taken some steps to sort of manage costs, mostly things like cost shifting, an increased focus on health and wellness programs, and then offering some low-cost plan options, alongside richer benefits that they have for their employees.
3 years ago, we offered a HSA, MSA benefit, large deductible with the MSA or the HSA attached to it. And that was the only real option we had. We saw fairly significant reductions. So this year, after 2 years of fairly sizable increases in premium, we sat down with them and looked at the options. And intriguingly enough, we're interestingly stuck. Our particular benefit plan does not meet the qualifications of ACA. We don't yet hit Cadillac. Right. If we want to change a plan to find a less expensive benefit, our only option is to go into the exchange model itself, or the plans that Cigna currently has that line up with that, all of which are considerably lower benefits with higher premiums. So our choice is to provide our associates with less benefits at significantly higher premiums, or frankly move out into a self-insured status, which we're just frankly not in the size to really be able to afford that change at this time.
Brokers realize that their role is changing. They need to stay relevant for clients. So a lot of what they've been doing has been consultation with their clients to help them come up with ways to control costs and how they can design their benefits to offer them the most that they can for the least amount of money. And then they also help work with them to negotiate competitive plans. Some brokers talk about focusing more on voluntary products as well.
I talked about the levers that drive costs. I mean, listen, at the end of the day, when we consult our clients, everyone wants to have a competitive plan. They want to know what their competition's doing. They want to have their plan, have the leverage in the market to bring on good people. Yet when they see the price tag to do that, that's not always something they're willing to do. So I do think price is always going to be a driving factor in it.
I think there are ways other than stripping down plans or increasing employee contributions that we can get there. And a lot of that is happening, between carriers and providers today.
And consumers manage healthcare costs by trying to be healthier, eating right, exercising, minimizing high-risk behaviors, quitting smoking, that kind of thing, losing weight. And then they also, in terms of how they get care of themselves, they go to clinics, they look for discount programs, they'll go to they'll buy over-the-counter medications so that they don't need to get a prescription. When they have a more severe issue, they'll visit an emergency room for it. And here's a quote from a consumer. I try and take care of myself in terms of getting regular checkups, and if something's going on, I go to the doctor, get it checked. At this point in my life, it's mostly about cost relative to not changing things. My wife has a doctor, my kid has a doctor, and I have a doctor. So the implication of this is, offering flexibility in plans so that employers can provide choices to meet the varied needs of their employee population. They're going to have some folks who want, more benefits or need more benefits and can pay a little bit more, but then they're also going to have to meet the needs of their employees that are looking for a lower cost option. And then also giving them tools so that they can compare. So in Plan A, this is what you would get, and this is what this procedure or this medication will cost you for Plan A, and this is what it would be for Plan B, so that they can make decisions, with all of the information available to them. So there's a lot of confusion about exchanges. Employers are aware of the concept, but little else. They know that every state is going to be offering one. They understand the concept of, the differing levels, bronze, silver, gold. But beyond that, they really don't know much more about exchanges. There's a lot of skepticism that they have about it. They worry about the quality of care that their employees would be able to get being less through the exchange. They worry about their employees' ability to actually navigate the exchange. And then they also worry that people will, if left to their own choice, people will not necessarily choose the right plan for them or the right benefits, that they're going to be driven by cost, and they're going to end up not necessarily having the coverage that they need.
And we've also been looking at the private exchange models, both from a business standpoint as well as right now we're digging into those. Are those a viable option for us, particularly in New Jersey and some of our other areas where we don't have the same level of federal or state exchange activity in place? Yeah. I have to be honest with you, from a buyer standpoint, they're a bit of a mystery in terms of which ones are the best, how do you navigate those models effectively, and then more importantly, how do we ensure that our employees are skilled and capable of managing that? The last thing I frankly want is our employees spending 40 hours trying to understand and navigate the exchange when we really would like to have that 40 hours put into delivering work for our clients.
Brokers do feel exchanges would be a good option. They acknowledge, though, that the employer's comfort level could be an issue, and they know that they need to get their clients more comfortable with it in order for it to really be viable. They think that consumers will be able to follow an exchange with the appropriate assistance, but they wonder whether or not the support needed is going to be there.
Until those exchanges, and we saw it when the public exchanges went live or thought they went live, until we're comfortable with what they offer in the process, I think very few employers, that most of which are only as good as their employees and want to ensure they have the best people, and the benefits package is absolutely part of getting that and keeping them. Until they're comfortable with what that process looks like and what plans they have access to, I don't see many taking that, that aggressive approach that just says, you know what, if it's so great, you guys go nuts and find a plan for yourself.
Consumers have a very limited understanding of exchanges. They will need support if and when they go there. They have very little brand loyalty. They're very cost-driven. So in that aspect, some of the options that they might have there may be more appealing.
I remember it being like pretty user-friendly, but I do remember thinking to myself, like, man, if people aren't up on their knowledge or lingo of health stuff, they're screwed looking at this stuff, because there was a little bit of a it's Greek to me kind of element to it. Personally, it was almost like when too many things are on the menu and you don't know what to order for food. So I would say it was almost like a little bit too much.
So the implication here is, that it is important for any exchange to provide support for employees so that they're not a burden on their employers and that they're not losing time, valuable time, trying to navigate the exchange instead of working. Also offering competitive options on the exchange, and then tools to compare so that individuals who go on the exchange can quickly and easily see side by side all the different plan options and know which one is the best for them. In terms of alternative approaches, employers really have very little awareness of what's out there. They need the brokers to educate them and help keep them up to date with the latest changes. And they also, as we saw when we were talking about the exchanges, they need to have proven success in order for them to get past any skepticism that they have about these alternatives. Here we have a quote from an employer. It's interesting, high deductible plans have had lower adoption and use than I would have expected, but I imagine that this next year we're going to see that jump as we change our employee contribution and start to move it down to an industry norm of probably 80%, that we may see more associates move into that particular plan. Brokers do recommend alternative solutions to their clients. They see several trends that they think are going to really grow in the future. ACOs, narrow networks, defined contribution, telemedicine are all common things that the brokers talk about.
Health and wellness is absolutely something that we're building out as an entire unit within our organization and as part of the consulting approach that we have with our clients, and I think will only continue to grow, because when you work with clients that are 1,000+ lives, I mean, their claims drive their costs, and you can do all these great things, but ultimately if their employees are going to the doctor and are unhealthy and are having high-cost procedures, they're going to pay the price. 5 years ago, people talked about it, didn't do much with it for the most part. Those that implemented did it more with, hey, we'll reward you if you participate in this plan. And we are certainly starting to see many more clients talk about and certainly more actually implement the stick approach, where it's going to cost you more and or you won't have access to the better plans if you don't actively participate in these programs.
Consumers really don't know of or talk about any alternatives, but given their cost sensitivity, they would be open to less expensive alternatives. It's important that it's marketed in simple, easy to understand language for consumers. So continue to be creative in designing plan options and offering employees and consumers as much variety in coverage, cost, and allowing them to find a package, a combination of both the benefits that they'd be receiving for the price that they want to pay. So just to summarize what we talked about, knowledge of the specific details of healthcare reform is very limited. So it's important to keep brokers in the loop since they're a big source of the information for their clients, and also provide education and resources for employers and consumers wherever possible. Most employers and consumers are adopting a wait-and-see approach. That everybody's really reluctant to change, but it is important to maintain strong broker relationships since they're going to be kind of the driver of that change for their employers. As soon as they're able to get employers more comfortable and open to the idea of change, and also offer a variety of plan options so that people can kind of find the plan that suits them. Few people understand the details of how an exchange works. They will need support for employees and individuals who are going to be using the exchange. Make sure that there's competitive options for them, and then offer comparison tools so that they can look at different plans easily, quickly, side by side, and compare the different payments that they'd have to make as well as what they'd be getting for those different plans. A lot of people are still evaluating steps to manage costs. It's important to offer flexibility so that employers can provide different levels of plans for their employees to meet the varied population needs, and then also detail show a detailed cost comparison. And alternative approaches, are being considered, although there's reluctance. So continue to be creative in designing plans and offering employees and consumers as much variety. A lot of what we hear a lot of times is kind of like a menu where they can, there's not necessarily plan A, plan B, or plan C, kind of make their own plan. So they could say, well, I want to take this and this and this, and kind of find a combination that suits their budget. Just a few final thoughts. We have a quote here from each of the different populations that we spoke to. From employers, being educated on the mandates, fees, fines, and hours, and where it's going and how it falls out. I think ACA is here to stay. As a business owner, we're going to have to make the best choice for our employees and ourselves. Become super educated and make sure whoever our broker is, we get information so we can make the right choices. From a broker, I think there's going to be a market at some point as exchanges continue to have a strong foundation and footing to help individuals navigate them. There might be a whole other market for brokers that may be focused on smaller groups that can help navigate individuals through the process as well. And from a consumer, the exchange is something that people need to worry about today, but I think a lot of what healthcare reform really means hasn't played out, but will in the future. I just want to thank everybody for joining me today. My information is up there. Please feel free to reach out to me. You could always, go on our website too, and there's always information there as well. But you can reach me, contact me directly if you have any needs.